For decades, we've been taught that bone loss is something you feel in your back, your hips, or your wrists. But what if I told you that one of the earliest and most reliable indicators of bone deterioration is hiding in plain sight every time you brush your teeth? The connection between your oral health and your skeletal system runs far deeper than most people realize, and understanding this relationship could be the key to catching osteoporosis years before it becomes dangerous. I'm here today not as someone trying to diagnose or treat your condition, but as a health educator who wants to share some remarkable discoveries that could change how you think about bone health. The truth is, your teeth and jawbone serve as an early warning system for what's happening throughout your entire skeletal framework. When you understand what to look for, you gain a powerful tool for protecting your health as you age. The problem begins with a fundamental misunderstanding of how bone loss progresses. Most people assume that osteoporosis develops gradually and uniformly throughout the body. They expect to notice it first in their spine or hips, perhaps through a sudden fracture or persistent back pain. But the reality is far more complex, and fortunately for us, far more detectable than we once believed. After age 60, your body undergoes significant changes in how it manages calcium, phosphorus, and the countless other minerals that keep your bones strong. These changes don't happen in isolation, and they don't affect all bones equally. Your jawbone, which supports your teeth, is actually one of the most metabolically active bones in your body. This means it responds quickly to hormonal changes, nutritional deficiencies, and the natural aging process that affects bone density. What makes this particularly important is that your jawbone is also one of the first places where bone loss becomes visible and measurable. Unlike your hip or spine, which require specialized scans to assess bone density, your oral health provides daily opportunities to monitor what's happening to your skeletal system. The key is knowing what signs to watch for and understanding what they mean for your overall bone health. The most significant indicator appears in the form of tooth mobility and changes in how your teeth fit together. Many people over 60 begin to notice that their teeth feel slightly loose, especially in the morning or after eating certain foods. This isn't simply a result of gum disease, though that can certainly contribute to the problem. What's actually happening is that the bone supporting your teeth is losing density and volume, creating space where there should be solid support. This process begins at the microscopic level, where the intricate network of bone tissue starts to develop tiny gaps and weak points. As this network deteriorates, your teeth gradually lose the firm foundation they've relied on for decades. The loosening sensation often comes and goes initially, which is why many people dismiss it as temporary or unimportant. However, this intermittent mobility is actually your jawbone's way of signaling that significant changes are occurring in your bone metabolism. Another critical sign appears in the spacing between your teeth. If you've noticed that gaps are developing where none existed before, or that existing gaps are becoming wider, this could indicate that your jawbone is actually shrinking. As bone volume decreases, the supporting structure for your teeth changes shape, allowing them to shift position. This shifting often happens so gradually that people attribute it to normal aging, but it's actually a measurable indicator of bone loss that can be addressed if caught early. The gum line also provides valuable information about what's happening to your bone density. When the jawbone loses volume, your gums may begin to recede, exposing more of your tooth roots than was visible in the past. While gum recession has multiple causes, including aggressive brushing and periodontal disease, bone loss is a significant contributing factor that's often overlooked. The recession typically follows a pattern that mirrors the underlying bone loss, creating an uneven gum line that becomes more pronounced over time. Changes in your bite provide another important clue about bone health. Your teeth are designed to meet in a specific pattern that distributes chewing forces evenly across your jawbone. When that bone begins to lose density, your bite can shift in subtle ways. You might notice that you're hitting certain teeth harder than others when you chew, or that your jaw feels tired more quickly during meals. These changes occur because your teeth are compensating for the loss of underlying bone support by shifting to find new points of stability. The science behind this connection reveals just how closely linked your oral and skeletal health truly are. Your jawbone is composed of the same type of tissue as your hip bones, spine, and wrists. It responds to the same hormonal signals, requires the same nutrients for maintenance, and undergoes the same age-related changes that affect bones throughout your body. The difference is that changes in your jawbone become apparent much earlier because they directly affect structures you use and observe every day. Research has shown that people who experience significant bone loss in their jaws are at substantially higher risk for osteoporotic fractures in other parts of their body. This isn't coincidental. The factors that weaken your jawbone are simultaneously affecting your entire skeletal system. By paying attention to oral health changes, you're essentially monitoring your overall bone health in real time. Hormonal changes play a particularly important role in this process. Both men and women experience hormonal shifts after 60 that affect bone metabolism, but the pattern differs between the sexes. Women often see more rapid changes due to the continued effects of menopause, while men typically experience a more gradual decline related to decreasing testosterone levels. Regardless of gender, these hormonal changes affect the jawbone quickly and noticeably. The jawbone's response to hormonal changes is so predictable that some researchers have proposed using oral health assessments as screening tools for osteoporosis. The idea is that regular dental examinations could identify people at risk for bone loss years before they would typically receive bone density testing. This approach could revolutionize how we think about preventive care for skeletal health. Inflammation also plays a crucial role in connecting oral and bone health. Chronic inflammation in the mouth, whether from gum disease or other sources, can accelerate bone loss throughout the body. The inflammatory chemicals produced in response to oral bacteria don't stay localized in your mouth. They enter your bloodstream and can promote bone breakdown in distant locations. This means that maintaining excellent oral hygiene becomes even more important as you age, not just for your teeth and gums, but for your overall skeletal integrity. Nutritional factors that affect bone health show up first in your oral health as well. Calcium deficiency, vitamin D insufficiency, and inadequate protein intake all contribute to bone loss, but their effects become apparent in your mouth before they're detectable in other bones. Your body prioritizes maintaining bone density in weight-bearing locations like your hips and spine, which means that nutritional deficiencies often manifest first in the jawbone. The good news is that recognizing these early signs gives you a significant advantage in protecting your bone health. When you identify jawbone changes early, you have time to implement strategies that can slow or even reverse bone loss throughout your body. The interventions that benefit your jawbone will simultaneously strengthen your entire skeletal system. Weight-bearing exercise becomes particularly important once you recognize signs of bone loss in your oral health. While you can't directly exercise your jawbone, the same activities that stimulate bone formation in your hips and spine also promote healthy bone metabolism throughout your body, including in your jaw. Regular walking, resistance training, and balance exercises all contribute to maintaining bone density by signaling your body to continue investing in skeletal strength. Nutritional interventions can be remarkably effective when implemented early. Adequate calcium intake is important, but it must be balanced with sufficient vitamin D, vitamin K, magnesium, and protein to be properly utilized. Many people focus exclusively on calcium supplementation without addressing the other nutrients necessary for bone formation. This incomplete approach often fails to prevent continued bone loss and may even contribute to other health problems. the timing of meals and supplements also affects how well your body can use nutrients for bone building. Calcium absorption is optimized when intake is spread throughout the day rather than consumed in large doses. Combining calcium-rich foods with vitamin D and magnesium enhances absorption, while certain foods and medications can interfere with mineral uptake. Entender estas interacciones te permite maximizar el potencial de construcción ósea de tu dieta. Professional dental care becomes even more critical when you recognize the connection between oral and skeletal health. Regular cleanings and examinations allow for early detection of bone changes, while professional treatments can address inflammation and infection that might accelerate bone loss. Your dental team can also provide personalized recommendations for maintaining oral health in ways that support your overall bone health. The relationship between oral health and bone density is so strong that some dental professionals are trained to recognize signs of osteoporosis during routine examinations. Certain cambios en la densidad del hueso de la mandíbula, visibles en radiografías dentales, pueden indicar la necesidad de pruebas de densidad ósea años antes de que aparezcan síntomas. This collaborative approach between dental and medical care represents an important advancement in preventive health strategies. Sleep quality also affects both oral and bone health in ways that become more important with age. Poor sleep disrupts the hormonal cycles that regulate bone metabolism, while sleep disorders can increase inflammation throughout the body. Additionally, people who sleep poorly often grind or clench their teeth, which can accelerate tooth mobility and worsen jawbone problems. Addressing sleep issues becomes an important component of maintaining both oral and skeletal health. Stress management plays a similar role in connecting oral and bone health. Chronic stress eleva cortisol levels, which directly interfere with bone formation while promoting bone breakdown. Stress also often leads to teeth grinding, poor dietary choices, and neglect of oral hygiene routines. Learning to manage stress effectively supports bone health through multiple pathways. The medication review becomes particularly important when you understand how many common drugs affect bone metabolism. Blood thinners, certain antidepressants, proton pump inhibitors for heartburn, and many other medications can interfere with bone formation or accelerate bone loss. Some of these effects show up first in oral health changes, making it important to discuss any new symptoms with both your doctor and dentist. Environmental factors in your home and daily routine also influence bone health in ways that become apparent through oral health changes. Adequate sunlight exposure for vitamin D production, safe flooring to prevent falls, and ergonomic arrangements that promote good posture all contribute to maintaining bone health. These seemingly unrelated factors are actually interconnected components of a comprehensive approach to skeletal wellness. The psychological aspect of recognizing bone loss signs shouldn't be underestimated. Many people feel anxious when they first notice changes in their oral health, worried that these changes represent irreversible decline. However, understanding the connection between oral and bone health actually provides reason for optimism. Early detection means early intervention, and the strategies that improve oral health often have benefits that extend far beyond your mouth. Social support plays an important role in successfully implementing bone health strategies. Family members and friends who understand the connection between oral and skeletal health can provide encouragement for maintaining good oral hygiene, following nutritional recommendations, and staying active. This support network becomes particularly valuable when making lifestyle changes that require sustained effort over time. Regular monitoring allows you to track your progress and adjust your approach as needed. Simple observations about tooth stability, gum health, and bite comfort can provide ongoing feedback about how well your bone health strategies are working. This self-monitoring capability empowers you to take an active role in your health rather than waiting for professional assessments to gauge your progress. The integration of oral health into your overall health management represents a shift toward more comprehensive and preventive care. Rather than treating dental health as separate from the rest of your body, this approach recognizes the interconnected nature of all your biological systems. This perspective often leads to better outcomes because it addresses root causes rather than just managing symptoms. Understanding the bone loss signs that appear in your teeth after 60 provides you with a powerful tool for protecting your long-term health. The connection between your oral health and your skeletal system runs deeper than most people realize, creating opportunities for early detection and intervención que puede prevenir complicaciones graves a largo plazo. Your teeth and jawbone serve as an early warning system for changes happening throughout your skeletal framework. By paying attention to subtle changes in tooth stability, spacing, gum health, and bite comfort, you gain valuable insights into your overall bone health years before problems would otherwise become apparent. This early awareness creates opportunities for intervention that can slow, stop, or even reverse bone loss throughout your body. The strategies that protect your oral health simultaneously support your entire skeletal system. Regular exercise, proper nutrition, stress management, adequate sleep, and professional dental care all contribute to maintaining bone density and preventing fractures. When you understand these connections, every positive choice you make for your oral health becomes an investment in your long-term mobility and independence. Remember that recognizing these signs isn't about accepting inevitable decline, but about taking control of your health journey. The bone loss indicators that appear in your mouth are signals that your body is ready to respond to positive changes. With the right approach, you can maintain strong bones and healthy teeth well into your later years, preserving both your smile and your skeletal strength for decades to come. The path forward begins with awareness, continues with action, and leads to a future where age doesn't have to mean accepting weakness or limitation. Your oral health holds the key to understanding and protecting your bone health, giving you the knowledge and tools you need to age with strength, confidence, and vitality.